Hi, this is Dr. Jeremy. I want to talk to you about spinal tension. If you've been a patient of mine, you've probably heard me talk about this. I want you to imagine a guitar string. There's a certain amount of tension in the spinal cord and in the spinal column that's always present. But if that spinal tension becomes too great, it leads to things like headaches, inflammation, muscle tension, and the list goes on. Nerve pinching. So how do you know if you have an issue with this? Well, first realize that as we stand to the side, we're going to have a curve in the neck going forward. We're going to have a curve in the mid-back going backward. We're going to have a curve in our lumbar or our low back going forward. So when spinal tension becomes very tight, what happens? We start to lose these curvatures. Can you tell if you have spinal tension? If you're very aware of your body, then yes. You may start to notice that, boy, I've got to crack my neck all the time just to get some relief, or I'm starting to have headaches pretty frequently. You may have low back pain all the time, or you might start to experience numbness. All these are signs that you have spinal tension, but what really helps us understand it and know where to go is taking x-rays. And that's why I'm a big proponent of taking x-rays. It enables us to see exactly what's going on in the spine. We don't have to guess, and it also helps us to know what we need to do in order to address that problem and to ease that spinal tension. And that's why patients, if you've seen just a recent Facebook post, one patient after 2 weeks has restored range of motion in the neck. Why is that? Well, we're not only focusing on the neck, we're focusing on the pelvis. That's the base of the spine. We're focusing on the low back, the mid back. The spine works together holistically, and you can't treat spinal tension unless you treat the whole spine. So what we want to do is understand what needs to be adjusted. Realize that every adjustment builds on each other. You didn't get there overnight, and you're not going to release that spinal tension overnight. So what are some things that you may not want to do if you have spinal tension? If spinal tension accumulates to an end stage, that's when we start to have things like sciatic pain, shooting pain in the arms, things that we just can't ignore, and they'll keep us out of work. And these things are very debilitating. Sometimes medical doctors will suggest that we have surgery done. Just some statistics. Lumbar spinal fusion. This is a surgery where they fuse a joint in order to stabilize it so that the nerve isn't being pinched. But what happens when you create even more stability in the spine? You're creating more tension at other levels. And that's what happens. Above and below that will begin to get tighter, and it affects the whole spine. We understand sometimes things are at the end stage and there's nothing else that can be done. But we should always consider chiropractic care as our first approach when it comes to the spine. Just a number for you, 1.62 million instrumented spinal procedures will take place this year. With lumbar spinal fusion, your rate for disability goes up and opiate use goes up. These are not things that you want to consider unless you've exhausted all of your other options. And why do people do this? Well, oftentimes chiropractic care has to come out of pocket. Whereas if you have insurance, well, they'll cover that $10,000 to $100,000 surgery for you, maybe more, but they may not cover any chiropractic care. And so that's often why people have to choose something like that. We need to change in our medical system, don't we? But if you're able to, chiropractic care is always the first choice. Thanks for watching.